Well, October is Breast Cancer Awareness Month, and today on the show we're at Coastal Family Health in Biloxi talking to a couple of the technicians about the importance of early detection. And as you can see by their mission statement, they're always here to help ladies in the community across the Gulf Coast. Jada Verling-Hill is a women's nurse practitioner here at Coastal Family Health in Biloxi. How are you?
I'm good, thanks.
Tell us a little bit about yourself and about what you do here, your role at Coastal Family Health.
So I am a women's health nurse practitioner. I've been with Coastal for 6 years now. There's also a women's health nurse practitioner located at our Gulfport clinic, and so the two of us can offer women's health specific specialty things if you have GYN issues going on. But as far as for regular screening, we can do pap smear screenings. We can also order breast exams and mammogram screenings. In addition, many of our primary care providers throughout the majority of our clinics on the coast and even into the more northern counties can offer the same kind of screening things that are offered for regular women's health. So if you are needing your mammogram, this is a great month to come do it. Of course, Breast Cancer Awareness Month. We can do on-site mammograms at this clinic right here in Biloxi. A lot of times it can be same day, or if you coordinate your appointments, we can try and slide you in at the same time when you come in for your pap or your breast exam.
Now, a lot of women, of course, are told that you should do self-exams, whatever, and you teach them how to do them.
Right.
Is there a point where they should start coming in on a regular basis?
Right.
I mean, as far as an age?
So there's screening guidelines that we follow. It starts at age 40. You can start coming in for your just clinical breast exam prior to that point, or of course if there's any issues going on, if you're feeling any kind of lumps or any kind of abnormal pain. But a regular screening mammogram we can start at age 40, and then those are done annually as long as everything's normal.
Now what about just regular checkups, just
right.
coming in as
So
that?
yeah, we offered
starting at a younger age.
Yeah, offer pap smears starting at age 21, and then those are done every 3 to 5 years depending on the type of pap you received. And like I said, the breast cancer screening as far as just a clinical breast exam can be done annually.
Now, if you are, I guess if your family has a history of breast cancer, should you start getting those exams earlier instead of waiting until 40?
So it depends on the age of diagnosis. We usually can start 10 years prior to a first-degree relative, which would be like a parent, a child, or a sibling. We can start your screening mammograms 10 years prior to their age of diagnosis. So even if that becomes before 40, we can start you earlier on.
Okay. Anything else? I mean, like I said, this is Breast Cancer Awareness Month. Any other words of advice?
So we also participate in a program called the Mississippi Breast and Cancer Cervical Screening Program. It offers financial assistance for patients that can't afford either to come have their pap done or to have mammograms if we need something further than what we can offer here, such as a diagnostic mammogram or an accompanied breast ultrasound. We can have you come in and fill out the paperwork for that. Once it's approved through the state, we can refer you out to an outside facility and they can continue your care as far as continue with diagnostics, or we can also refer you for breast biopsies if necessary.
Okay, thank you so much, Jada.
You're
Appreciate
welcome.
you very much for the great work y'all are doing here. Let's talk to another one of the technicians here at the Coastal Family Health in Biloxi. Heather Towner is a mammologist?
Mammographer.
Mammographer, okay. All these technical names and everything. Tell us exactly, okay, what is a mammographer?
A mammographer is first and foremost an x-ray tech who has specialized in mammography, has the training and the registry behind it.
Okay, now technology has come so far ahead in leaps and bounds in recent years, and doing, because I can remember back one of my wife of mine years ago had breast cancer, and what she went through and the technology then, and we're talking 30 years ago, 30, 40 years ago, a lot different than now.
Absolutely. This machine is state of the art. This is our 3D mammography machine made by Hologic, and it is amazing. 3D is the new gold standard for screening for early breast cancer. So it used to be we only could see the 2D. Now we can see all through the breast, beyond the dense tissue, beyond the vascularity, everything in the breast can be seen now.
And this basic, I mean, it will rotate?
Correct.
Whenever you're doing it?
Yes, if I need to, when I go to do my different views, Jim, I can rotate the machine for the patient.
Wow. So they don't have to lay on a table or do, and move around
No.
or do something and stand in funny crazy positions.
Well, a little bit.
A little
They
bit.
do a little bit.
But
for
still
sure.
a lot easier than what it used to be.
Absolutely. I mean, I haven't been having mammograms for 20, 30 years, but I hear from my older patients how much better the machines are. Every time they redesign it, it's better for the patient comfort, and the pictures are just so much better.
Now, it is Breast Cancer Awareness Month, and that's
Correct.
one of the main reasons that we're here today to talk about that and how important early detection is and the role that Coastal Family Health does in helping women, in early detection.
So women always ask me, why do I have to have a screening mammogram? And the answer to that is very simple. Mammography is still the gold standard for early breast cancer detection.
Right.
After skin cancer, breast cancer is the most common cancer for women. In fact, 1 in 8 women that reach age 80 are going to get breast cancer. But this early detection is key. If you're coming every year for your screening mammogram and we catch something early, the rate of success is 93% or higher for the first 5 years. So that's why we come and do our annual screenings, because we catch things early.
Now, that's what's very important, because catching things early cuts down, I guess, on the amount of treatment they necessarily need. They may need a mastectomy. It might be a simple mastectomy. It might be a radical mastectomy. And then, of course, you're having to deal with radiation and chemotherapy. Does it, finding early detection, kind of lessen the chance of having to go through all that?
It can, because if a woman comes every year for her screening mammogram, you can see cancer in its very early stages, versus if she skips 5 years and it's grown. Especially women that are still premenopausal,
Right.
because they still have the hormones, which makes the cancer progress faster. So the best thing, when you catch it early, you can even just do the lumpectomy versus the whole mastectomy.
Right. Now,
So-
and that makes it a whole lot easier. And knowing that you don't have to go through all the reconstruction that someone has to deal with if they have a full mastectomy.
Correct. And my patients ask me, why do I have to do it if I have no family history of breast cancer? Simple answer, most women that get breast cancer do not have a family history. There are other things that influence it, so that's why it's
And
important.
I've heard
to do
that sometimes it jumps a generation, and that's not necessarily true. Like the grandmother may have it, mom may not get it, but then the daughter could get it.
Because there are other things that influence breast cancer. It's not just family history.
Now, if someone wants to come to Coastal Family Health to get mammography or mammogram, what do they need to do?
Coastal Family is offering screening mammograms here for all our patients. I do them all day long, and I am more than happy to accommodate all our female patients that are willing to come in here.
All right. Thank you so much.
You're welcome.
Appreciate it. You need to do that. You need to give them a call at Coastal Family Health.